Hey, this is Dr. Rebecca Baxt, board-certified dermatologist here at Botox Cosmetic in Paramus, New Jersey, and I'm going to give you a primer on Botox and its close relatives. Botox, right here, botulinum toxin, was the first one FDA approved. This is now many years ago. It's been approved really since the 1990s. It got cosmetic approval in the early 2000s, and we've been using it since in this office since the year 2000. So many years. It's excellent. And then came along Dysport, which also got FDA approved. Then came Xeomin. We also have Daxxify. There's two others that have been FDA approved. One is called Juvo and one is called Letibo. They're all basically the same thing. They're all botulinum toxin type A. They have just slightly different proteins around them, slight differences. I describe it as the difference between Coke and Pepsi. Some people like Coke, some people like Pepsi, but they're basically brown, fizzy, sweet liquids. So I just want to go over sort of the basics. Botulinum toxins basically relax muscles. So we use them to help with lines in the forehead. When people get the 11, sometimes it's 1, sometimes it's 2 forehead lines. So this is the glabella into the forehead lines. We use it for crow's feet. Those are the FDA approved areas. It's also gotten FDA approved for the neck, for the vertical bands. It's also used very commonly for masseter muscles. I use it a lot in the chin. I use it a lot in the perioral area around the mouth. I use it a lot in the nose and up under the eyes. Those are non-traditional areas, but it works great. It has a lot of FDA approvals for other things. It works for migraines. It works for muscle dystonias, but we use it cosmetically and it's incredibly safe and incredibly effective. One of the upsides is that, it works incredibly well. It works pretty fast. Within a couple of days, the muscles are relaxed and the wrinkles are decreased. It's done in a quick, easy office visit. It hurts a little bit. It's not that bad. If the pain bothers you, people will use numbing cream, but most of our patients don't. It's not even really necessary. The main downside really is bruising. And that is fairly common because it is injected with a needle. There's no other way at this point to get Botox in. If you see someone saying, oh, topical Botox, there is no such thing. It requires a needle. So we just ask people to try to avoid blood thinners so that they don't bruise. But if people bruise in our office, we do offer no charge laser as long as I'm here the next day to try to make the bruising go away faster. And we also recommend arnica, which is an herb that comes in pills and gel and cream that helps bruises disappear. So Botox is done in a quick, easy office visit. There's multiple brands. My favorite is brand name Botox. I've been using it for 26 years as of this video. We get fantastic results. Oh, it's also FDA approved for reduced sweating. So we do use it under the arms as well. So that's another place to add. The upside is that it works fantastically well. It's the satisfaction rates are through the roof. People love it. It becomes a little bit mentally addictive because you love the way that it looks and it's so easy, but it does only last around 3 months. So that's a little bit of the downside, is that you do have to keep it up. I do recommend every 3 months for almost all patients. There are people who get longer out of it, typically after many years of use, particularly in the glabellar muscle. It starts to weaken and we also start to forget how to frown. And so the Botox can last longer, for some people 4 to 6 months, but routinely it's every 3 months, and it's usually every 3 months for a number of years before a select number of patients will get more longevity out of it. It is not my opinion that anything else works really particularly longer. People say, well, maybe Dysport works longer, maybe Daxxify works longer. I think it's very patient dependent, and that's why we stock multiple in case people want different ones. We can try them, but I am always a fan of the brand name Botox. And I think that's about it. Some of the other side effects, sometimes people get a headache from it that usually lasts a day or so. It is also FDA approved for migraines. So most of my patients who are headache-y types of patients find that their headaches go away when they use their Botox. But when you actually do it, that day you can get a headache. So be careful of that. We talked about the bruising. People worry about an eyelid droop. That's when the Botox actually moves and goes into an eyelid muscle, and then it is hard to open one of your eyes. I have seen that once in 26 years. It is a very rare side effect. It is treatable. It requires eye drops. It's really a pain if that happens, but it's very rare. I do Botox all day, every day, and I've seen it once in more than 2 decades, so it's not a common side effect. The thing that I ask people to do to try to avoid it is after your Botox injections to keep your head upright for at least 3 hours. Don't go home and take a nap. Don't go shoe shopping and look down. Try not to be cooking over a hot stove and looking down. Just want your head upright for at least 3 hours. The botulinum toxin gets taken up in about 90 minutes. I always like to add a little extra time to that. So I say 3 hours, and I prefer no gym that day. So if you love to work out, I tell people, please work out before you see me. And then once you have your Botox, just take it easy the rest of the day. Keep your head upright. Don't go home and take a nap. And then hopefully the Botox does not move somewhere it's not supposed to go, which is typically, it's fine. Like I said, it's incredibly rare to have that side effect of the Botox moving into a muscle where it's not supposed to be. So the results are great. Everybody loves it. I love doing Botox. It's one of my favorite things because it makes people so happy and it's so easy. So hopefully we'll see you for Botox sometime soon.